We are live. Please just wait for the Vandana before you start.
Yes.
जय हो आदि शल्य चिकित्सक सुश्रुत महर्षि, प्राणी मात्र के क्लेश निवारक कारण करतासी। जय जय जय। धीर स्थिरत्वं काशी निवासी, विश्वामित्र कुलोत्पन्नः, शिष्योत्तमासी, शल्यतन्त्रोपपन्नः। मुण्डितश्मश्रुश्वेतवसनः स्नातः शुचिः सुविचारी, धन्वन्तरी के अनुयायी प्रभु तुम दिव्य तेज मूर्ति। अग्नितप्त यंत्र शस्त्रधरः वैद्य श्रेष्ठ हितकारी, हाथ धरे शस्त्र संदंशक छुरिका करतरी, रणभग्न तिमिर अर्बुद अर्षादि रिपुहर्ता, प्रत्यारोपण शुचि निर्जंतुकरण के आदि उद्गाता। के सिद्ध चिकित्सक त्राता, दग्ध रक्तावसेचन से शीघ्र शूल हरता, जनपद ध्वंस से तुम मुक्ति दाता। तव चरणी शरण मनोज गावे अमृत गाथा। जय हो आदि शल्य चिकित्सक सुश्रुत महर्षि, प्राणी मात्र के क्लेश निवारक कारण करतासी।
गुड इव्हनिंग एव्हरीवन. नमस्ते. आवाज येतो मॅडम?
Yes, you are audible.
Respected all dignitaries, our esteemed guest speaker, Dr. Yogesh Bindale sir, President of TAS, our respected Madam Suvarna Golecha, respected patron Dr. Rajesh Pawar sir, moderator of today's session, Dr. Praveen Bhatt sir, and Dr. Yes, ma'am.
Dr. Puranik sir is yes.
Respected Dr. Puranik sir is also with us. Today's moderator of today's session, Dr. Praveen Bhatt, Dr. Ganesh Jadhav sir, all respected faculties, my seniors, juniors, my colleagues, and all participants. It gives me an immense pleasure to welcome you all to today's webinar organized by TAS India Association on a very interesting and important topic, that is oncology in Shalakya Tantra. It is privilege for us to be associated with TAS India Association and coordinating this academic session, which brings our attention towards very important and increasingly relevant area of healthcare. Myself, Dr. Sunita Khare Pagare, practicing as an ophthalmologist in Nasik, Maharashtra for last 26 years, as the director of Sujay Netra Seva and our upcoming Orion Eye Hospital. It is my privilege to coordinate today's academic session with my colleague, Dr. Rajendra Singh Patel. Dr. Rajendra Singh Patel is an associate professor in PG Department Shalakya Tantra at Mansarovar Ayurved College, Bhopal, as well as he is recently selected and guided for PG Star Project. Friends, oncology is an area where traditional knowledge and our modern scientific understanding can offer valuable perspectives to each other. Oncology in Shalakya Tantra is very important and significant because early recognition, appropriate evaluation, and timely management of a lesion involving head and neck can have a profound impact on patients' outcome. We are extremely fortunate to have with us our esteemed guest speaker, Dr. Bendale sir, who will sharing his valuable knowledge and experience with us on the fascinating subject. On behalf of Tas India Association, I extend a very warm welcome to Dr. Bendale sir and all the participants who are joining today's webinar. I am sure this session will be academically enriching and will give us an opportunity broaden our outstanding on oncology through the perspectives of Shalakya Tantra. Dr. Rajendra, please continue.
Good evening, everyone. Myself, Dr. Rajendra Singh Patel. I welcome to our TAS India patron, respected Dr. D.P. Puranik sir. I welcome to you, and respected Dr. Rajesh Pawar sir. I also welcome to you, sir, and our president, ma'am, respected Dr. Suvarna Golcha, ma'am. I welcome to also you, ma'am. Dr. Sunita, ma'am, please continue.
Okay. It is my privilege to introduce our moderator, one of our moderator, Dr. Praveen Bhatt sir. Dr. Praveen Bhatt sir completed his BMS from Tiyak Ayurved College, Pune, followed by his MS in Shalakya Tantra, Government Ayurved College, Nanded, and his PhD from Government Ayurved College, Nagpur. He is currently working as an associate professor and head of department at All India Institute of Ayurveda, Goa, and has over 16 years of experience in clinical and surgical ophthalmology. He has guided several postgraduate students and has presented his research at national and international conferences. He has also received Young Ophthalmology Achievement Award from National Institute of Ophthalmology, Pune, and have him as a Today, we are very fortunate to have him as a moderator of today's session. Dr. Praveen Bhatt sir, I warmly welcome you. Our second moderator of today's session is respected Dr. Ganesh Jadhav sir. Dr. Ganesh Jadhav sir completed his BMS from MUHS and his MS in Shalakya Tantra from KUHS. He is a founder of ARC Ayurved Clinic Pune and has been actively participating Ayurvedic ophthalmology since 2016. He has treated over 19,000 patients through the Ayurveda and has experience in managing complex ophthalmic conditions, including retinopathy and neuropathy. Dr. Jadhav has also contributed significantly to research and development in Ayurvedic ophthalmology, including the development of several Ayurvedic ophthalmic formulations. Dr. Jadhav delivered lectures on Ayurvedic ophthalmology at national, international platforms and has been recognized for his contribution to healthcare, including the Rotary Priyadarshini Award for Rural Health and at the Ayurveda Excellence Award. With his rich clinical experience, research orientation, and dedication to Ayurvedic ophthalmology, we are delighted to have Dr. Ganesh Jadhav sir with us as one of the moderator for today's webinar. Dr. Jadhav, I also welcome you. We look forward for your both's valuable contribution to today's academic session. Dr. Rajendra.
It is my pleasure and privilege to introduce our esteemed guest speaker, respected Dr. Yogesh Bendale sir. Dr. Bendale sir is an internationally renowned Ayurvedic physician scientist, inventor, and entrepreneur with over 3 decades of experience in advancing evidence-based Ayurveda through modern scientific research. He is the chairman and managing director of Rasayu Life Sciences, Pune, and a CRAV Guru of Rashtriya Ayurved Vidyapeeth, New Delhi. His remarkable work beautifully bridges classical Ayurvedic wisdom with modern science, molecular biology, nanotechnology, and clinical research, particularly in areas such as oncology, diabetic retinopathy, and chronic disorders. His academic and research contributions are truly remarkable, with 44 patents, 52 international scientific publications, and more than 110 international scientific presentations. To his credit, he has also been instrumental in developing numerous standardized Ayurvedic formulations and has served more than 1.5 lakh patients. His recent international scientific recognition, including research involving more than 3,300 solid tumor patients, presented at the ASCO Breakthrough Conference 2026, further reflects his significant contributions to evidence-based Ayurvedic oncology. With such an illustrious experience and expertise, we are truly fortunate to have him with us today for this insightful session on oncology in Shalakya Tantra. Sir, we are honored by your presence. I warmly welcome you and request you to kindly enlighten us with your valuable insight. Sir, please.
Thank you so much. Do I expect to start or you're going to
Yes,
talk?
Yogesh. Yes, yes, sir.
Okay. So in the beginning, I must thank Tas, all the committee members, Dr. Rajesh Pawar sir, Suvarna, Dr. Praveen Bhatt, and most importantly, our senior most sir who taught us, Dr. Puranik sir. I'm little stressed seeing her in the frame. So forgive me if I do any mistakes. So thank you so much, everyone, and especially Suvarna for taking this initiative. So the idea is that we never decided to do something in oncology in Shalakya Tantra as such, but since we are into oncology, especially through Ayurveda, we have pulled out a couple of cases data which can be presented over here. So this is the simple sharing of our experiences. So there is no blame, no claim, but simply sharing. And I would love to hear your comments or any areas of improvements for us. We are open for all the suggestions. So this is little theory that we all know that typically what's happening? What's happening? Just a second, that bar is coming between the slides. Okay. So oral, pharyngeal, laryngeal, salivary gland, and PNS, paranasal sinus. These are the typical areas of ENT cancers. We don't want to get into the subtypes of like squamous cell carcinoma. But most of the cancers, more than 90%, as we all know, are squamous cell carcinomas. Here is a little saddening kind of information or the data. What we all know that 1/3 India, counts 1/3 of the global burden in oncology. Over 3.16 lakhs new cases annually India is getting belongs to head and neck cancers. whereas about 1.4 lakh mortalities are there per annum. The 30% of all the cancers belongs to head and neck, whereas the another disturbing fact is that around more than 55% of cases from Asia region are from our country. So this is the statistics of various cancers. Oral cancers weighs 58%, whereas pharyngeal goes for 22, then laryngeal about 15%, and rest of the other thyroid, nasal, or salivary gland cancers, all putting together to 5%. Everybody obviously talks about the smoking kills, alcohol kills, smoking leads to cancer, alcohol leading to cancer, etc. Many patients who visiting our clinic, they keep on asking this question that I never smoked, I never drink, but why did I get this kind of cancer, which is known to be because of tobacco or smoking, etc. So this is where we think that Ayurveda can play a very good role. We may not just think all the time between the symptoms and the alleviation of symptoms through some or the other treatments or medicines, but the why comes from patients and it triggers our mind that they never smoke indirectly also. So in spite of that, they got these cancers. So in Ayurveda, we all know that Dhumrapan is mentioned. Obviously, it is not related to what is being used in those nicotine leaves, and all those things are not there, obviously. But at the same time, we find two classes. One class, they keep on smoking a lot, but till at the age of 80, they don't get cancer. On the other side, somebody never smoked, but got the cancer at the age of 40, 40 or 50. Both the things triggers our mind that why in both the cases it happens. Because we think one of the idea to think about that there are rules and regulations of Dhumrapan given in Ayurveda. Though it is not just related with nicotine, but that means that Dhumrapan is a regulated activity. And we don't have a very measured kind of a data, but we keep on asking these questions to such patients when we come across these guys above 75, 80 who are heavily smokers but never come across cancer. They are not suffering from cancer. Then at times we realize that directly or indirectly, they are following major guidelines, what is being explained in Ayurveda, that they smoke only after food. They do not smoke lot many cigarettes a day and things of the kind. So along with, I would rather say that along with smoking what we smoke, the regime of smoking plays a very vital role. And I think Ayurveda is a very primitive science or old science which gives these guidelines about the smoking. So maybe this is what we do in non-cancer clinic, that we advise these guys to, at least if you are not able to quit the smoking, how can you regulate your smoking? That also helps in prevention of cancer. So we belong to Ayurveda, and we all know that the first choice of medicine in our country is the Western medicine. So we are not the one when people visits immediately after first diagnosis of cancer. Now, after working on more than 25, 30 years in critical illnesses, around we keep everything very well recorded, documented, analyzed, and validated, reviewed, etc. So recently we found that 15% of patients suffering from cancer for the first time, immediately after diagnosis, they visit Rasai Cancer Clinic as a first choice of treatment. But obviously we advise them to go for surgery if at all it's a surgically operable, or ask them to go for the surgeons, oncosurgeons' opinions, and so on. But in spite of that, large population comes with at various stages of cancer, and that is where we come across various challenges and treatments related to and limitations related to treatments. So one major aspect is tumor resistance and recurrence. This is a big threat not only in front of physicians, but this is a bigger threat in front of onco scientists or cell biologists. And they realized that there is huge amount of data and publications related to this is available, and largely this has been done in European countries and America, and to some extent in Japan. So why these resistance comes across, why these cancers keep coming with a short span of time? These are the big questions. We'll get into these nitty-gritties, but it's not today's topic. Then the limitations to surgery. Not all cancers are resectable. Then head and neck, especially the structures are very tricky. So limitations of surgery ought to happen. The latest breakthrough in oncology is immunotherapy. Everybody talks about immunotherapy. I keep visiting oncology conferences in the United States, and every 3 slides of every one who is presenting talks about how we used to use this chemotherapy, and now we realize that this is a better approach, and we don't use chemotherapy, especially in United States, and they are changing the global protocols of NCCN also, and immunotherapy is being introduced. At the same time, immunotherapy takes a lot of time to act, and the cost is highly prohibitive for the countries like us. Unfortunately, many of our patients, according to ICMR data, the 88% of patients comes with the diagnosis of cancer in stage 3 and stage 4. That is the sad part of India. At the other side, the functional and quality of life side effects due to disease burden or due to the treatments are the fairly major challenges and limitations. So when it comes to the tumor resistance, the data says that about 76% of head and neck cancer shows the natural drug resistance. This is not a good news at all for head and neck cancer patients, because it's not the drug induced resistance as such, but the natural drug resistance. Then the treatment acquired resistance is up to 50% patients develop this kind of recurrence resistance, and cancer comes back or at the same site or distant site as is metastasis. The response rate to the treatments like cetuximab or platinum-based combinations, up to 1 out of 3 patients get good results. At the same time, most 2 out of 3 patients suffers from resistance. When it comes to the surgery, we all know that this is a critical anatomical structures, risk of severe functional and cosmetic deficits, and tumor that have spread too far the blood vessels plays a vital role in surgery. So obviously it triggers and the metastasis. At the same time, it limits the surgical operations. The functional and quality of life, swallowing, speech, breathing, nerve damage, disfigurement, the cosmetic things are the other important things which are more dealing with the psychology, that I can't swallow, I can't speak properly, my facial the muscles or this thing is distorted. So this gives more trouble and mental stress or the depression to these patients. When it comes to immunotherapy, we all know that the PD-1 and PDL-1, which is a program death ligand 1, is the latest and one of the biggest immune checkpoint inhibitors, which has been first taken to the world by world leader company Roche from Switzerland. But in spite of that, a great drug, it gives 1 in 5 patients response to this cost of immunotherapy, this Keytruda kind of thing. This PD-L1 inhibitor is a Keytruda, name of the drug is Keytruda. So 1 in 5 patients, it shows response. At the same time, it is fairly prohibitive to large Indian population. At the same time, many patients develop primary or acquired resistance to immunotherapy too. On the other side, like other cancers, for example, breast cancer, ovarian cancer, pancreatic cancer, or gallbladder cancer, where there are fairly reliable biomarkers. But for head and neck cancers, there are hardly biomarkers which are dependable. So rather there is no biomarker, especially for head and neck cancers. At times people keep on doing LTH, but that's the only thing which gives some idea, but still it is not dependable. Then recurrence in head and neck cancers is again another challenge. So the data says that within 2 years, 60% develops loco-regional recurrence, whereas 20 to 30% develops distal metastasis. So there is a reason why these recurrence is so high in head and neck cancers, because as we discussed that the advanced diagnosis, so 2/3 of patients comes with the advanced stage. Then field cancerization, widespread tissue damage increases obviously the risk of new tumors or relapse and complex anatomical structures. The functional quality of life side effects, as we say, that xerostomia is again a very disturbing sign. Patient is not able to swallow anything because of the extreme dryness, swallowing, speech impairment, and the high toxicity burden because of the drugs, especially it is considered to be DLTs, dose limiting toxicities of these anti-cancer therapies, leading to kidney damage, neurological damage, and so on. So these are the patients who keep on visiting Ayurved clinic, and we have to categorize these patients in a different manner. We are going to see what sort of categories we have made and what sort of treatment we are planning for these patients. But before entering into the practical classification of these, what are the principles that we have to understand while treating cancer? Any cancer actually, it's not only just ENT cancers. So here is a interesting thing that Ayurveda and Gita principle and its clinical application. In Bhagavad Gita, Bhagavan Sri Krishna mentioned that Jata Sehi Dhruva Mrityu. Whoever is taking birth has to die. So this is actually applicable to cancer cell also. But nature of cancer cells is not like that. It keeps on multiplying. But this principle is applied ideally to cancer cells also, and it is being seen. We've done a couple of animal trials for our medicines, and we have seen that Ayurvedic medicines, unlike the Western DNA alkylating agents or cytotoxic agents, our medicines are not killing the DNA or the nucleus of a cell. In spite of that, the tumors are reduced, tumors are not formed. This is all being seen and proven, and those sort of publications are already there and presented at international conferences too, that how Ayurvedic drug can induce a tumor regression. So it's very interesting. And I think because unfortunately we are not well equipped with the because research needs deep pockets, large amount of money. And whatever we are doing, it is all out of passion to serve Ayurveda, to serve our country, our patients. And in a most rational manner, how can we take this forward so that the large scientific community can look at Ayurveda that, oh, look, there is something. And then people keep on doing more and more work into that. That is what our thought process is. So we are investing a lot into research from our own resources. We have not taken any government funding or any other agency, etc. But it's a kind of a interesting thing, and there's a lot of good learning. We have diversified people who have joined hands with us. So Jatasya Dhruvamritu, we have given these drugs to animals, and even we have seen in patients, their tumors can be reduced completely, 100%. It is called complete regression, and which has been seen on PET scan. So how these cells are dying? So all we know that Utpatti, Sthiti, and Lay is again one of the fundamental principles of Ayurveda. Actually, it's a natural principle from nature. And this is nothing but we didn't know about cell cycle rhythm because it is from the cell biologist and the oncoscientist field. But when we realize that every cell cycle rhythm goes from this cycle only, utpatti, sthiti, and laya. So from here is the diagram, which is interesting one. 0 to 1 is the utpatti. So the cells keep on producing. Then 1 to 2 is the maintenance, the quality and quantity of the cell. Is in a way it's a cell life. And then these cells degenerates on its own. This is 2 to 3 natural degeneration or a normal cell death. On the other side, Ayurveda defined sharir, shiryate tat shariram. Whatever degenerates is body. It is very interesting principle that in the beginning of our life, we keep on regenerating, we are growing, we are increasing our weight, volume, etc. But after certain age, only degeneration persists. So rate of degeneration is lesser in the beginning years, but it is far bigger in later years. But degeneration is the main thing. That's why the Sharyate Tat Shariram is very important to understand. So degeneration is inevitable. So cancer cells can undergo potentially to degeneration. Eventually they die, and we need to create the environment inside the body or induce such things to these cells so that these cells can die naturally. It is called as apoptosis in scientific language. So, as we all know that Ayurveda thinks about the whole system biology approach. We do not work like on one single line etiology. It's not what Ayurveda is talking about. So, this is how we look at cancer. Cancer is a new drug, a new disease. And I am sorry, you may not be agreeing with a couple of my statements, but I am open to learn. But I don't think that cancer is explained in Ayurveda in any manner as a disease itself. So correlating cancer with Arbuda, correlating cancer with some or the other uh, disease which is mentioned in the text, I don't think it's a right approach to understand the new diseases. So new diseases to be understood from what has been known to the world and applying the fundamental principles of Ayurveda. So I always think that Ayurveda needs to be divided into Tattva, Shastra, and Vyavahar. So Ayurveda, it is mentioned that, and many people think that, many people believe that Ayurveda is Shashwat in nature. Of course, we all believe Ayurveda is Shashwat in nature. But what is Shashwat from Ayurveda is Tattva or Siddhanta. Then Shastra at that particular time, the Shastra is being developed according to the needs of the society at respective timelines. And then it is being applied or used as a Vyavahar in day-to-day practice. We call it as a clinical practice. So as the time changes, the challenges changes, the newer and newer diseases are coming up. So what is Shashwat in Ayurveda is fundamentals. So unless we understand these fundamentals and apply these fundamentals in today's time, we believe with the help of technology, so that we can bring those principles into a scientific rational manner, and then it can be used by masses into a vyavahar. So I'm sorry, we do not correlate. And there is another scientific reason to that, because we keep discussing these things with multiple doctors and Vaidyas, especially in Ayurveda Vaidyas. So if somebody tells about that for a pancreatic cancer, he thinks he has diagnosed it as a rasa sheshajirna or ajirna some type or grahani, whatever. But a simple question to that is that whether the treatment given under that regime in maybe Charak or Sushruta or Vakbad or whoever another Samhita, why it can't reverse the disease. Forget whether it is cancer or non-cancerous, which is known according to the Grahani. We don't know. But the treatment, it should work and the cancer should get into remission. But this doesn't happen. That means we need some little different understanding, and we need to be open to learn from the oncoscientist and cell biologist about cancer itself. But when it comes to the fundamentals, that's why we take cancer as it is, that cancer is the type of the organs, breast cancer, pancreatic cancer, prostate cancer, lung cancer, and so on, obviously with the subtypes. But then we get to know what system it belongs to, then what is the Mula Sthan. Then Prakruti, we don't consider much Prakruti I personally, in my practice. Again, I'm telling you this, I'm sharing my thoughts. I may be completely wrong, but I don't think I'm able to judge any patient's Prakruti because most of the patients visit with their Vikrutis only. Then yes, causative factors, which plays a very vital role. But again, it plays, even though vital role, it has a very limited role to play, even though it's very important, because elimination of causes takes time to act on a human body. And most of the time, this kind of lifespan these patients do not have. So we have to have balavantam upadravam turnam chikitsit kind of approach. So lateral thinking or something else. Sara Saratva, yes, it plays vital role. Again, family history plays very, very important. The another interesting thing, what Ayurveda believes is Agni. And Dhatwagni and Jataragni are the things which we consider as the most important things while treating cancer. But in a very simple language, if we understand cancer from Ayurvedic perspective, is that what happens that there is a enormous growth of the cell, regeneration of the cells, and there is these cells are not dying. So cells are taking birth, that is jivana, and they keep on multiplying also. So janana. So janana, sorry, there is a spelling mistake. There should be janana. So jivana and janana, these are the principal karmas of jivana is Rakta Dhatu's main karma, and janana is Shukra Dhatu's main karma. So if we want to understand cancer from Ayurveda perspective, we think that the Samavayi Karan of cancer is Rakta and Shukra Dushti. Without Rakta and Shukra Dushti, cancer as a process is not able to start. So this is very interesting, and we believe, and that's why in all the sampraptis we try to understand these principles while designing the treatments. And we treat these cancers through Rasayana. As we all know that Arsha Grantha and Rasayan Kal, Rasa Kal, or the Rasa Shastra time period, it is being mentioned in the text that about 2,500 years is the Arsha Kal. After 2,500 years, Rasa Shastra Kal has been started, and the Nagarjuna was the founder or the one Rishi who initiated this. The interesting thing to know about Rasa Shastra is that the Nagarjuna, the Rishis, they didn't change the fundamentals of Arsha. They have changed the Adhar, Adheya, Dravyas of which are not mentioned at all in, or hardly only mentioned, I would rather say, not all, very few in Arsha Granthas. So this is a kind of any Shastra should be Pravahi in nature. It should be developing in nature. So while Charak was there, Sushrutva came. While Sushrutva was there, Vagbhat was there. After that, the Lagutrai came. After that, so many Granthas keep on writing. What is this? What does it tell? So it tells us about that obviously the science has to be a developing science. But unfortunately, in Ayurveda, last couple of hundreds of years, there is not a serious kind of development is seen. So large amount of development we can observe is in the era of Nagarjuna. And he mentioned why there is a need of Rasa Shastra. So alpamatropayogitvat aruchai raptasangata kshipram arogyadayitvat aushadibhadiko rasa. So very minimal doses, fastest acting drugs. This is the main motive behind Rasayan or Rasa Shastra. And when it comes to the Rasayan, what does Rasayan do? This is a typical reference from Charak Samhita, Dirgamayu Smriti Medham, Arogyam Tarunam Vayaha. So this is what we get from Rasayan in general. So the first, that is how the Granthas have been written. the first word is very important, Dirgham Ayu. What is in danger in cancer is life. The lifespan, anybody gets to know that he is suffering from, she is suffering from cancer, then they realize that now my very few months are left. Now I am not able to live longer, something like that. So it threatened the Ayuhu, the life is being threatened. And Rasayana is exactly the first thing what Rasayana offers is Dirgham Ayuhu, which is a basic and fundamental need of or the expectation of a cancer patient. Then it comes to Smruti. I don't want to get into this, but it is very interesting to know why this Smruti we generally consider Smruti as a only recalling of something, but it's not like that. When we look at this, our fingers, then while during the our embryological development, why these hands develop like this finger develops like this, there is a gap and this finger stops at this development. The other finger is little longer than this, again it stops over here, whereas there is another gap between two fingers. Why this is all happens? Because the cells have a memory, and the rasayanas are not just recalling something what we have learned before or what we have seen before, but every cell's memory is being referred by rasayana or smruti over here. And Medha again. So I'm sorry. So let's not get into that. But the point I'm trying to tell you is that Rasayana, what it offers in general, is very important in cancer treatments or for cancer patients. So what we have done to our patients that we have standardized the therapeutic and diagnostic protocols. So diagnosis and also evaluation is done through Western as well as Ayurvedic parameters. We do have, we all know that Ayurveda parameters are only limited to clinical signs and symptoms, whereas the Western parameters, obviously from blood tests to all sorts of imaging, we follow. The comprehensive approach in evaluating case, we consider the tumor burden, then symptoms, quality of life, and obviously expected survival. Even though we work in Ayurveda, especially when we are working in this Rasa Shastra, we cannot take our science, since Ayurveda is great, since Ayurveda is Shashwat, since Ayurveda is being used by thousands of years, since thousands of Vaidyas are using Ayurvedic medicines, it must be safe. When it comes to science, we cannot take anything granted. So we evaluate each and every drug for its safety also independently. It's a third party validation, and obviously for efficacy also. How the safety evaluations are done, it is a typical drug development model we have adopted, which is not only in India, but all over the world. It's called as CTCAE criteria. And we have developed the software which gives information about safety of our drugs, and thousands of patients data what we have kept, and about 25,000 plus patients data we have kept who has consumed Rasa Shastriya medicines from months to years together with fairly or extraordinary safety documented, and these kind of data are being published in international conferences also. So LFT, RFT, CBC, you know, all those things in addition to the clinical things, it's all is covered in CTCAE. So when it comes to the efficacy is not always measured in terms of tumor burden. How the tumors are reduced, that is one of the important parameter, but it's not the important only parameter. There are many other things, especially when we talk about when we look at the international scientists who gives advices or the guidelines to physicians all over the world, is most important is the quality of life and overall survival. It doesn't matter. Let's not run behind only reducing the tumor burden, because at times reducing the tumor burden may lead to mortality of a patient. But if the patient is asymptomatic, then let him or she be asymptomatic, be very extremely vigilant, and take the action as and when necessary. But in spite of asking for 2 or 3 months at the end of life, let's put 6 months or 1 year, which is when the patient is good, and offer these years to the life to this patient. So these are various parameters. The FACT-G is for quality of life, then HAD score is for anxiety, depression, PSQI for sleep quality. These are multiple things. But things, the most important we follow is the racist criteria that is considered to be the golden criteria to assess the efficacy of cancer treatment. So we follow racist criteria too, in addition to the tumor markers. So why we are doing these protocols? What are the objectives? So obviously, as I said, there's safety and efficacy. Obviously, the critical assessment, unbiased and critical. A rational path for global understanding, because people do not understand when we want to bridge a gap between Western oncologists and Ayurvedic doctors, then we have to talk in their language, because it is not easy for them to talk in our language. So somebody has to build a bridge. And that's why we chose this, that let's talk in their language as far as the safety and efficacy is concerned. And then obviously we learn all the time. Every physician is learning. We have to be open all the time. And the most important thing is that when we talk about Ayurveda is personalized, this doesn't mean that Ayurveda's one drug cannot give reproducible results to another Vaidya. It's not the case like that. So reproducible results is the one which bring our system into a rational science category. And then the widespread applications or use of any science is obvious to happen. And obviously it increases confidence of Vaidyas and scientists. So the world or the society is being driven by key opinion leaders, and those are the ones who run the society. So social awareness is also very important for us nowadays. Patient acceptability, caregivers, how we care for caregivers is also being explained. And chronic consumption, especially, we think that some Ayurvedic people, I heard that they're saying that these rasayanas cannot be taken more than 3 months. But at least I never come across any of such kind of guidelines from the granthas. And on the other side, we have patients who have taken these medicines for years together with extreme safety parameters. So when it comes to the classification of patients and the robust outcome measures, this is the fundamental what we are considering. Most of the head and neck cancers visits us post-surgery. So objective of the treatment is to increase the disease-free survival. The second objective is to increase the metastatic or metastasis-free survival. The other class which visits our clinic is that chemo and radiation is ongoing, and still people visit Rasai Cancer Clinic for various objectives. So we have categorized whether can we help these patients by synergistically to reduce their tumors, or can we help them to prevent the metastasis and when it is localized, or can we help these patients to reduce the side effects of the chemo or radiation. The third class, which is that who have taken the exhaustive treatments from the Western sciences, they are not anymore eligible, or because of the other comorbidities, they are not eligible, or they become intolerant or resistant to the earlier treatments. This is a large pool which keep visiting Rasai Cancer Clinic. Then in those patients, our objective is increase the overall survival with great quality of life. Then this is a systematic patient classification. Post-surgery, if they come, their disease-free survival and survivorship care. Obviously, we give Vyadhi Pratyanic Rasayan. This is again a little controversial topic that when we treat somebody, we treat them based on the symptoms. But ideal treatment should be based on the Vyadhi and Vyadhi Pratyanikam. Yad dosha pratyanikam, tad na Vyadhi pratyanikam. Kintu yad Vyadhi pratyanikam, tad avashyam dosha pratyanikam is been mentioned by Madhavan in Madhav Nidan. So what is more prevalent, what is more important is Vyadhi Pratyanik. Once we give something Vyadhi Pratyanik, then doshas are generally taken care. But it is not the other way around. If we keep on running behind only management of doshas, then what we are doing is to manage the symptoms only. And this will not take us very far. So that's the difference between Rasa Shastra and the earlier these things, thought processes. Then we give complementary rasayanas to these patients. And thus, when it comes to survivorship care, again we give rasayan diet and all those things. When the second class comes with the patients going chemo and radiation, then obviously the tumor regression, prevention of metastasis, reduced side effects, all with the help of Vyadhi complementary Rasayan and Rasayan. Then the third class comes with the chemo resistance. In spite of chemo resistant earlier cases, our objective still remains the same, that can we reduce the tumor burden of these patients, and how can we reduce the further spread or the prevention of further. It is called in scientific language, it is called as TGD, that is tumor growth delay. So this is again planned with the help of Vyadhi and complementary Rasayanas. Large number of patients comes with the advanced stage, as we discussed, then we put them on a palliative care protocol only to improve the quality of life with the overall survival. And sometimes the 8, 10, 12 lines of chemotherapy these patients are on, then we are in a supportive role to some patients who opt for such kind of thing. End stage patients not eligible for chemo or radiation, or it becomes when they become refractory, then the only thing is that only better quality of death is very important, and we believe that that's the right of every patient. Unfortunately, there was a survey happened in United States that all ICU patients were asked that where do you want to die? The 98% patients, 96% patients answered that we want to die with our near and dear ones at home. But out of those 96%, 98% patients died in the hospital. So their last wish was not also fulfilled. So these things matters a lot for that particular patient and also for caregivers. So Ayurveda and our sciences, Eastern thinking is fairly sensitive to these aspects where patient is at the center. So we are going to enlist the few rasayanas. So we will just enlist these rasayanas for the cancer management. As we all know, the Hirak is a very favorite drug many of the Vaidyas are using. And you can see that the qualities of Hirak is Ayush Pradam. In Rasayana, we have seen the quality of Rasayan. So Ayuhu is the one which is at threat, and Hiraka's first quality, it imparts life. So Sharirendriya Satvatma Sanyogo Dhari Jivatam. Sharir Indriya Sattva Atma, the linkages, all these putting together is called as Ayu. And Hirak is the one which gives this kind of thing. So we use it in all types of cancer, in critical cancer patients also. We believe that it helps to correct the defects in cell cycle. That's why it can be taken as a preventive care also. And it protects the vital organs and when patients are on highly cytotoxic therapies. Then Mahalakshmi Rasayan is specially for upper respiratory and lower respiratory cancers. It is cardioprotective in nature. When patients are on chemotherapy, their heart is obviously at stake. So this plays a vital role in that. Ojakshaya is the main thing, and Mahalakshmi Rasayan improves the Oja of these patients. Obviously, these patients are having a lot of fatigue because of disease burden and the treatments taken. Mahalakshmi is a great Rasayan to improve their fatigue. And most importantly, a very interesting finding, we found that when patients are on chemotherapy and they get opportunistic infections and pyrexias or the fevers are not very easily responding, Mahalakshmi is a wonderfully acting drug, just one capsule 2 or 3 times a day with Ardharakswaras, then it gives fantastic results, and most of our patients do not need any antibiotics or antipyretics too. Pranavallabh is again working for, because Shira has a lot of Marmasthana too, and Shira is Thana of Prana too. So malignancies of respiratory systems, and lungs, pleural mates, and also for the head, especially the brain, astrocytomas or glioblastoma multiforme and things of the kind. Then Somtajveer is, we use Somtajveer as a local application in gingival cancers or tongue cancers. or oral cancers for local applications rubbing on the tumor. This is very interesting combination, which is not seen in any of the Rasagranthas. This is where how we should change with the time. That's Tamra Basma and Hirak. This sort of combination, because Tamra is Lekan in nature and Hirak is Bhuvan also in nature. We believe that Hirak is Lekan. It's not like that. So this is the Janana and Lekan. These two karmas are addressed in this combination. Malignant fluid accumulation, there's a lot of swelling in ENT cancers. Then pleural effusion is also seen in lung cancers or pleural or uh, asbestosis kind of things. The non-healing wounds of head and neck cancers are being helped with this is given orally. We all know that this is called Tamarabasma. We all know that the Ayurvedic medicines do contain nanomaterials. So nanocopper is known for its anti-cancer properties. You can find out multiple publications of this. The protha is a typical anti-cancer kind of rasayan, where we can see that the Hirak Basma is in large quantity, and then the Moktik Basma is also in large quantity. This is a very cancer-specific rasayan, a simply anti-cancer kind of a thing. It helps corrects the errors in cell cycle rhythm, protects vital organs, reduces the risk of metastasis, overall increases the survival, and multiple cancers we are using as a main anti-cancer drug. PZ is an interesting other combination we use in as a palliative care. That is why we have stratified these patients, that when these patients come at a stage 3 or 4 or becoming refractory or resistant to Western therapies, then this is a choice of rasayan we use for these patients. Then it helps to reduce it controls the rate of progression of disease. And it has a capacity to manage the widespread symptoms of these cancers. Dadichi is again the very interesting. You do not find any metal in this, only ratnas are there. And mainly for when it comes to the head and neck, these bone structures are fairly large, involved in multiple head and neck cancers. So for skeletal involvement or maybe a bone cancer or bone metastasis, Dadichi acts wonderfully well to reduce the pain. At the same time, it reduces the cancer burden at the bone level. It improves the overall quality of life, and increases the overall survival. This is the simple oil we use to apply. This is a very interesting thing, because Uttamanga Shodhan is very important at times, and these cancer patients are not eligible for any other kind of Shodhan. So this works in a dual manner. It is a counter irritant also, and it takes out the malas which are locked in the especially paranasal sinuses, and reduces the facial edema or the swellings, and helps to control the cancer cells. This is oral healthcare oil we use especially for oral cancers and stomatitis, mucositis due to anti-cancer therapies, precancerous submucosal fibrosis, or the leukoplakia. This is simple used as a gandush. So loss of taste post chemotherapy. Xerostomia is a big challenge. So simple gandush works wonderfully well in these cancer patients. So this is more towards academic kind of thing, whether it has any applications in real world science. So there are a couple of studies. I'll go a little faster because we are running short of time. So main important thing is that when patients have taken the primary care by surgery, especially, then improve the disease-free survival or progression-free survival or overall survival. So survival response is very important. And these rasayan formulations exhibit the immunomodulatory activity. These are not immunosuppressants or immunostimulants also. So that's why these rasayanas are immunomodulatory. in action. So secondary prevention is very important. So this is a case one where the long-term disease-free survival in early stage tongue squamous cell carcinoma following surgery with adjuvant exclusive Rasayan therapy. Many of the times patients are traumatized by their earlier experiences from their near and dear ones. So they come to the clinic with the firm decision, even though we ask them to go to the other surgeon, two more surgeons, take second opinion, but they are very firm that I have seen this fellow, I have seen my relatives or somebody who is suffered from such kind of thing, and we couldn't see their miserable death. So we don't want to get into that route. So after surgery, they opt for exclusive Rasayan therapy. And this is a 51-year-old female. And she was suffering from squamous cell carcinoma grade 1. Partial gastrectomy was done. R0 resection was there. And exclusive Rasayan therapy was initiated in 2021. Then the continuous surveillance was there. And till August 2026, the clinical disease-free survival is seen. So these are the medicines given. Let's not get more into this. So more importantly, what is the importance of this case? So post-surgery, this patient has started exclusive Rasayan. About 5 years done. FACT-G is improved. That is how we control this through our software from 82 to 92 with stable ECOG, which is 1. During the 20 months of treatment period, no adverse drug reactions were observed, no any toxic signs. Completed RCC protocol, that is actually our 18 months protocol. There are 3 phases. Each phase is of 3 cycles. Each cycle is of 2 months. This is a typical protocol for Rasayan therapy. And she was on surveillance from 2023 after stopping the treatment. Achieved 64 plus months of disease-free survival with a great improvement in quality of life. What data says, what the documentary evidence says that the median recurrence in oral carcinomas is 14 months. So this patient remained away from cancer coming back for about 5 years approximately as compared to the published data. So why this case? That is how this case is important to note that disease-free survival is about 5 years with the following the R0 surgery with exclusive Rasayan. This is another case with the long-term disease-free survival in operated case of adenoid cystic carcinoma of minor salivary gland, origin A. Again, ongoing exclusive Rasayan therapy. So it's a young chap with 47-year-old and is suffering from the PNS was done and it is diagnosed with T0, N0 and TNM status is like this. So this is how the status, these are the scans. Treatment details are given on the right side, what sort of Rasayan we have used, what sorts of post-meal powder that is we keep for the symptomatic management and environment improvement inside the body. These Rasayanas are also focused on the tumor environment. Then the post-meal powder is especially given for the whole body environment. And the main morning Rasayan as an anti-cancer Rasayan. This is how these medicines are being planned. This patient underwent 30 radiations and then Rasayan therapy started after October 2022. So recent follow-up report with nasal endoscopy on 9th of April 26. This is a report. We have to hide the name of the doctor, but there is no incidence or evidence of cancer anymore. So disease-free follow-up from 22 to 26 is seen, and it is about nearing to 4 years of disease-free survival. So again, what is the clinical relevance of that? That as 3.8 years of ongoing disease-free survival in adenoid cystic carcinoma, but the continued surveillance remains essential because recurrence can occur obviously many years after the initial treatment too. So this patient is kept under surveillance. Up till now, it is not seen. The another important thing is that we believe that we do not have any anti-cancer medicines. It is true that we do not have any DNA alkylating agents as such like what the Western medicine is using. But can Ayurvedic medicines lead to tumor response exclusively with Ayurvedic treatment? And then the answer is yes. We have seen such cases where the complete tumor response has been seen, observed, and these cases have been reported in peer-reviewed clinical case reports. This is a reasonably challenging patient with the HIV positive status, a female, where the complete response, in spite of HIV positive, complete response and survival in a patient with stage 4 plasmablastic lymphoma. So date of diagnosis 2015, the disease burden, we can see that extensive malignancy is being seen as the right nasal cavity, nasopharynx, bilateral maxillary, right sphenoid, all the sinuses are being involved, right orbit. So it's a fairly extensive carcinoma on the head region. We can see that tumor size is 66, about 6 centimeter with very heavy SUV uptake value. So metabolic activity is also very high. From October 21, we have started Rasayan therapy and continued exclusively. The partial response to therapy was seen in earlier PET scan. After this Rasayan therapy, we have seen that the PET CT, these are the medicines, Pinzar, Rasayana, Hirakar, Pisa, Mahalakshmi again. So PET CT is seen on August 16, then 2017. This is where we got the complete tumor response. That time patient was on exclusive Rasayan therapy. And the response, we have seen that from extensive disease to partial response to good response and then complete response. These are the terms being used in respective evaluations. On the right side, you can see the PET scans. So the interesting thing about this is that the patients who is already having a very, very low immunity, and Rasayana is known to improve the immunity, and this is HIV positive active patient, but with the such kind of lymphoma and being treated with exclusive Rasayana, complete tumor response is seen. Disease-free survival 51 months. So no documented relapse through 12 March 2022. And now the progression-free survival again is 81 months from the diagnosis to the latest documented disease assessment. So this is a very interesting thing, and patient still is alive and asymptomatic. Last reporting was done on May 2025. So it is about 10 years from diagnosis. Then this is a post-surgery Epstein-Barr virus positive case with nasopharyngeal carcinoma and the tumor regression with the, again, exclusive Rasayan therapy. So it's a young chap, 18-year-old person, having these signs, visited biopsies say that the undifferentiated carcinoma. Then the Epstein-Barr virus was positive. PET CT showed that the right nasopharyngeal primary with cervical nodal spread. Since the residue of the after the treatment with chemo and radio, there is a residual nodal disease. Nowadays, I just visited ASCO, American Society's global conference in Singapore. Everybody talks about the residual disease, especially surgeons, and it has become a big headache for the oncologist how to deal with this residual disease, because it has a large potential to spread and to bring cancer locally at advanced stage. So that is a very important clinical importance of residual tumors. Radiotherapy was given, chemotherapy was given, cisplatin plus FIFO. PET scan after 2017 shows complete resolution. Cervical node shows partial regression with residual disease. And this is the challenge, big thing in this disease, where we started the exclusive personalized Rasayana. These are the Rasayanas mentioned, Protha, as we talked about, and Hiraka, the Dasma, and Sindur Bhushan, Mahalakshmi, and so on. So clinical outcome says the further reduction after starting the Rasayan therapy in metabolic activity of residual. So when the metabolic activity is reduced, that means Shiriyate Shariram, Utpatti Sthiti Laya Siddhantas have been applied over here. Reduction in LDH levels is a very clear-cut indication that the medicines are working. Resolution of presenting symptoms is the Ayurvedic way of understanding this case with clinical symptoms. With improvement in quality of life, patient was having great compliance with the treatment, and no treatment-related adverse reactions were seen. So the advantage Rasayan in chemo intolerable cases, when many of the times patients cannot tolerate, what is the advantage of Rasayan in such patients? So it improves the tolerability of chemo. That is, we are compatible, we are complementary rather to the chemotherapy. We are not against of chemotherapy. We are not antagonistic to chemotherapy. At times it has been talked and spread by the some few physicians that Ayurvedic medicines do contain metals and minerals. They are against acting against the chemotherapy, which is not the case. But nowadays it is not just simply enough by saying. We need to come up with the results and data in a very validated and scientific manner. So that's why all these efforts are going into that direction, and so that the patient can complete the conventional protocol and helps in tumor regression. So this is a next case with recovery from chemoradiotherapy-induced toxicity and long-term disease-free survival with personalized Ayurveda therapy in hypopharyngeal geriatric cancer. See, now the very important thing here to note is the 74 years person is a geriatric cancer patient with unstable angina. When these comorbidities are there, then there are hundreds of reports are saying that outcome of conventional therapies with comorbid conditions is not like the patients having no comorbidities. So this itself gives us the gap and the opportunity for Ayurveda to step into to help the society and improves the outcomes of cancer therapies. Addiction or smoking was there, then the clinical presentation was there, and then the lesion was seen and diagnosed as a grade 2 SCC. So T3 and N1 was the presentation. The conventional treatment timeline is like this. So they underwent the chemoradiotherapy, then 35 fractions of radiotherapy was done. After the evaluation with the chemoradio, significant tumor regression was seen, but the creatinine is raised. So treatment-related toxicities leading to discontinuation of the therapy. Started the Rasayan therapy, continued for approximately 3 years, and we didn't see any adverse effect with the good compliance. These are the medicines given. What are the before and after? We can see that the weight gain is there from 60 to 70 kilos, and creatinine come down from 1.4 to within normal limits in spite of given rasayanas which contains so-called metals from the Western point of thinking. So elderly patient was a challenge. This hypopharyngeal cancer is a challenge. Inoperable disease was a challenge. But this is all being helped to this case by integrative oncology in geriatric patients. So this is a great area for Ayurvedic physicians to help to the cancer patients. And one can take this ahead as a Ayurvedic Rasayan therapy as a cancer survivorship strategy following the curative intent treatment. Then the next case is chemotherapy intolerance to complete response. Again, with the help of Rasayana in PDL1 positive but high stage 4 oral cavity squamous cell carcinoma. Here is a long history of this case. It's a very challenging case, 59-year-old person with PDL1 positive. And it went through so many lines of chemotherapy and radiotherapy with unfortunately progressive disease. And when it comes to the January 2024, when seeing the progression, then started Ayurveda Rasayan therapy along with the erlotinib plus methotrexate. In 7th of May, the patient seen complete metabolic response. One can say that the metabolic response is being seen because of the erlotinib and methotrexate, which is a point, of course, for the discussion. But the data says that when the patient is not responding to the earlier lines of chemotherapy, is less likely responding to the next lines of chemotherapy, especially when it comes to the complete regression and complete response. So the Ayurvedic Rasayan therapy was given for 1.2 years. These are the medicines given. And patient was very with high risk with complex case. Rasayan incorporated during the chemotherapy and immunotherapy as a supportive measure alongside the conventional care. Then very high PDL1 expression, pulmonary nodules were there, and significant treatment-related toxicities during earlier therapy was not seen. Overall outcome is a satisfactory tolerance, then manageable side effects, quality of life is improved, and favorable complete response to tumor. This is very important area, and unfortunately in our country, we do not follow this branch as a serious branch in oncology. It is called as geriatric oncology. I was fortunate to work as a global vice president of multinational association in cancer care, which is the headquarters is in Canada. And I was a global vice president for geriatric oncology. And that is where we tried to bring a lot of principles from Ayurveda, how a patient-centric care should be given to geriatric cancer patients. So 60% of cancers and 70% of cancer-related deaths occur in individuals aged 65 and above. Whereas the significant treatment aversion was noted with 58% of. So this signifies the risk and on the other side opportunity to Ayurveda. So here is we are ending to the reaching to the end of our presentation. The geriatric case with a hard palate adenoid cystic carcinoma managed exclusively with Rasayan. So this is 2019, then 2 years PET scan showed stable disease. This patient was on exclusive Rasayan therapy. In March 2023, resumed Rasayan therapy after a brief loss to follow. Then again, mild radiological progression was seen, ECOG1 and improved quality of life. Overall, this patient is 7+ years survived with exclusive Rasayana with prolonged disease control and maintained functional status. So this patient was not eligible or didn't go for any other treatment, but exclusively with Rasayana. These are the couple of MRIs was done and the PET scans were done for during the patient was while on the surveillance and on this Rasayan therapy. These are the Rasayan details what we've used, personalized medicine powder, then Hirak, Dasma, again Pranvallabh and so on. We can see that the FACS-G has gone up from 83 to 93, whereas ECOG had come down from 2 to 0. This is a great significant, whereas there is some weight loss is also seen. After 7 years, the 10 kilos of weight loss is seen. But you can see that the hematological parameters are absolutely fair to this in this patient. So median expected survival of the stage 4 ACC is approximately 61 months. But this disease followed for 7 years and with absolute brilliant quality of life. So that is the importance of Rasayan in geriatric oncology. Then I think the last case is geriatric case of salivary ductal cancer with a high risk of recurrence. Surgery plus radiotherapy plus Rasayana therapy. It's a combinatorial approach in geriatric patient. After the resection, then radiotherapy. In 2024, standard Rasayan therapy alongside conventional treatment was started. 18 months of Rasayan protocol was completed without significant RT-related adverse effects. And recurrence-free survival is more than 3.5 years. So treatment approach is surgery plus Rasayan radiation plus Rasayan therapy prolongs the quality of life with the progression-free survival. This patient is under 40+ months ongoing for disease-free survival and still under surveillance. The data says that the about 3.2 years and expected survival in these cases is approximately not more than 5 years. Though this patient is recurrence free till date with ongoing survival 40+ months, it is still undergoing. So there is a management strategy for high risk patients with multiple recurrences. So high recurrence risk in oral cancer, advanced disease and adverse pathology, high risk tumor biology, persistent carcinogenic exposure and field cancerization. These are the risks to this. And yeah, the last case is the moderately differentiated squamous cell carcinoma with multiple recurrences, with surgery followed by exclusive Rasayan. There is a history of smoking. Surgery was there, wide lesion excision was there with radiotherapy done. First resection, then second resection was done after 3.5 years of disease-free survival. Overall, 2 documented local recurrences, but 7+ years of follow-ups, excellent ECOG and FACT-G, no reported adverse drug reactions. These are the Rasayana details, Hira, Dasma, Arpisa, and Protha. So the interesting thing is that the surgery works fantastically well with Rasayan therapy to improve the overall outcomes in these challenging cancer patients where the rates of recurrence is very high, especially in squamous cell carcinoma. So, whatever the data, what we have seen and shared are our experiences, and we are very open to share and to learn from everybody, from you. At the same time, we try to publish our work, and these are the international journals where our publications are already happened, where the impact factor is 45, Journal of Clinical Oncology. Then Annals of Oncology from Europe with the impact factor of 80. Then Cancer Research, one of the very renowned international journal, and a couple of cancer clinical case reports, total 52 publications. And we have taken Ayurveda with the grace of God, with the thanks to all our advisors, our colleagues, and our doctors working with us, that Ayurveda has been taken for the first time in the history of Ayurveda in India to the very credible allopathic platforms, because for the reason that one has to build a bridge and to start the communication between 2 different schools of thoughts for the betterment of society, that is ASCO, American Society, ISMO, that is European Society, then Multinational Association, American Association for Cancer Research, then Asia's biggest is Korean Research, Korean Society, and Integrative Oncology, SIO, and many more. So when we start working that, our own friends from Ayurveda obviously ridiculed us that because we advise patient to go for biopsy, we advise patient to go for PET scans. So ridicule was the first what we experienced. Then opposition, obviously, what you are doing is not Shuddha Ayurveda. It is not right to take science ahead. But it took 20-25 years for us to be accepted in our own people. Now the Vaidyas are being telling us that this is the right approach, and it is better to talk in the language which is being talked all over. And those who, according to, as per the Swamiji's statement, those who think ahead of their time are sure to be misunderstood. Nowadays, I'm not saying that everything which is mentioned in Ayurveda is 100% correct, but definitely Ayurveda is not well understood, at least, because we feel that Ayurveda is way ahead of time, because our Bhasmas contains nanomaterials, but nanotechnology is recently understood and still under development, but we are the people who have developed nanomaterials as well. So thank you so much for the organizers, Tas, Puranik sir, Pawar sir, Suvarna, Dr. Praveen Bhatt, and everyone who has given me this opportunity to present our work in front of you. Thank you so much indeed.
Yes, Yogesh, you have nicely elaborated through whole carcinoma oncology and treatments by Rasayan therapy. I just add something with your huge CV. Sir, we are classmates, Yogesh and me. And not only Dr. Yogesh, his whole family is dedicated to Ayurveda. Dr. Vinita is also doing very well from Dona Clinic. And I think Dr. Ishani and Dr. Rama are being postgraduates from Ayurveda, rather than they were eligible to take admission for modern science. And also, you're not only onco-physician, you're renowned onco-physician, Ayurvedic physician, but he's very kind person. to treat his friends and their family members. मैं इसकी एक साक्षीदार हूँ. When my elder brother was met an accident last year, he was at airport flying somewhere, but he immediately provided the treatment, and I am very happy to share that experience with you. Ganesh was also there in that team. I took the permission from ICU in charge to start the Rasayan therapy for this patient, and dramatic results I got it. And so many times Yogesh provided all those costly medicine free of cost to friends and family members. ये आपकी बहुत बड़ी उदारता है योगेश. एंड आयुर्वेद के लिए आपको अभी कंफ्यूजन था कि शालक्य में ये वेबिनार शालक्य के वेबिनार में व्हाई you are the non-Shalaki person is there, but you are working through this Rasayu Cancer Center so nicely, and your huge biodata and huge work. We want to our Shalaki persons also can inspire by your knowledge and your experiences and your pharmacy, Rasayan therapy. So I'm happy all our intention initiatives is being going to successful. Thank you, Yogesh.
Thank you so much, Varna, for these kind words. Thank you.
And
It was really, can I say something?
Yes, sir. Yes, sir. Yes, sir.
Yeah. Dr. Yogesh, it was really fantastic. I can say it fantastic because the results which you obtain through the Rasayu clinic and the Rasayu Chikitsa, those are really fantastic. The normal Ayurvedic physician, they are getting the results, but I think with the help of Rasa Chikitsa, it is really miraculous. I can always say it is a miracle. I just learned one thing from your presentation and the deliberation which you have just done now. Open mind to understand and inculcate the progress in the science. Keep the mind open. You are to accept the progression in various sciences, and accordingly, you can develop your own science. And the curiosity leads to research. Always try to ask why it is so. If these two things are there, and definitely each one of us and every one of Ayurved Snatak, they will definitely into this research quality. Thank you. Thank you very much for presenting this research.
Sir.
I would like to request Dr. Puranik sir, please share their valuable insights regarding today's session.
Oh, yes. Thank you very much.
Yes, sir. Yes, sir.
So I'd like to say a few words about Yogesh Bendale. As usual, his lecture was not only informative, but it actually had a great impact on the Ayurvedic research as such and science. I would say that he was very open to disclose, not keeping any professional secrecy in his lecture. He was very open to give all the details of his treatment, various rasayans in different cases. So it was as usual, it was very much informative and very much impactful. And I would say that while when we have actually a conference in the month of January at Pune, the delegates or participants who will gather for the conference, they should make a point to visit the Yogesh Bendale's institute, which he has recently started. Newly constructed and built and developed institute, Rasayu Life Sciences. So they should make a point to visit this institute, the ideal research institute of its kind. So it's very much a great thing to visit that institute, I would say. So, Dr. Yogesh, thank you very much for your this thing. And again, all his work, research work, is documented and has been published in various international journals. And so, the documentary, this thing is very much there. So, thank you very much, Dr. Bendale. Thank you.
Sir, I am blessed the things coming from you, sir.
Yeah.
Thank you.
Thank you, Dr. Bendal sir, for that enlightening and informative session. We would now like to hear the valuable perspectives of our moderators who have been an integral part of our today's academic program. I would first request Dr. Praveen Bhatt sir to kindly share his valuable insights, observations, and take-home message from today's webinar. Dr. Bhatt sir, may I request you to kindly share your thoughts with us? Dr. Bhatt sir.
Yes, thank you. Namo Namah, sir. Am I audible?
Yes.
Namo Namah, sir. Sir, thank you very much for your very insightful lecture, as always. Because you are Sachin Tendulkar, Virat Kohli in the oncology field of oncology. And we really delighted to hear you regarding your some of the experiences in the head and neck oncology, and a commendable rigorous publication process, as respected Puranik sir already emphasized, that documented evidences which played a very vital role in keeping an Ayurvedic or integrative Ayurveda in an integrative oncology platform as a first and foremost science. So, sir, thank you very much. I would also like to bring the discussion towards ocular oncology as well. So, particularly in the field of ocular and retinal oncology. So, here I feel the concept of the integrative oncology as an interesting and relatively an unexplored dimension. So, ocular oncology encompasses a broader spectrum like visual rehabilitation, then possible management in the treatment related with the ocular morbidities, then functional rehabilitation processes, then psychological well-being and long-term survivalship. So, sir, I would like to ask you, can you please throw some light on the ocular oncology, and can you please share your some of the experiences in this field? It will be an enriching experience for us too.
Yes, sure, Dr. Bhatt. I mean, this is the out of question syllabus for me, but we do have ocular malignant cases. I'll pull the data, and I would be happy to share that with you. Though it's not obviously, it's not in fairly large prevalence in oncology. The cases are very rare, but whatever we have, luckily we have the software which can pull this data fairly easily. So I'll get back to you on this.
Yes, surely, sir. And some of the points you already put forth, like a triage of the patient, like in the when patient comes to us in a disease state, along with the chemo and radiation therapy, and post surgical rehabilitation, like in a disease-free state. So these are some of the points you highlighted very well. And a rigorous publication process brought Ayurveda into an international platform is also commendable. So I think we should be very clear about the level of incidences which you have already put forth in front of us. So where the evidence is actually, what I learned from your presentation is where the evidence is currently available. So we should call it as a first line of treatment in the field of this integrative oncology. Where the evidence is emerging, we should call it as an investigational part. And where the evidence is absent, I think it will be a clearly identification it as a research question to make a strong therapeutic claim in future. So that's what I want to put my points from. I have learned the points from your presentation. Thank you, sir.
Thank you.
Thank you, Bhatt sir. Now I would request our second moderator, Dr. Ganesh Jadhav sir, to kindly share his valuable insights and perspectives to today's session. Dr. Jadhav sir, may I request you to share your thoughts with us? Dr. Jadhav sir,
Yes.
please.
Yes, ma'am. Thank you. Thank you very much, Dr. Bendare, sir, for that truly enlightening and thought-provoking presentation. I must sincerely appreciate the depth with which you have approached oncology in Shalakya Tantra. What I found particularly valuable was not merely the discussion of individual formulations, but the way you brought the classical Ayurvedic understanding of Rasayana formulations into the context of contemporary oncology. The Shastra Artha and clinical rationale behind these Rasayana formulations deserves serious academic discussion. Understanding why these formulations were described in our classics, their intended indications, processing, dosages, therapeutic potential, and limitations is extremely important. Sir, your presentation has reminded us that we should not simply look at the formulations as traditional preparations. We need to understand their Ayurvedic pharmacodynamics, clinical rationale, therapeutic potential, and contemporary relevance. I would also like to briefly share one clinical experience from my practice, not as a counterpoint to Sir's discussion, but as an example of how Ayurvedic management can sometimes offer an interesting clinical perspectives even when metallic formulations are not necessarily the central component. I had managed a case of orbital schwannoma associated with thyroiditis. When the patient approached us, there had been a relatively rapid reduction in his visual acuity from 6 by 6 to 6 by 24 by Snellen's chart, along with the ocular misalignment and mild proptosis. In this case, we followed an individualized Ayurvedic approach using Jalukavacharan Lepa Chikitsa and selected herbal internal formulations and some rasayana preparation also, including Netra Doshagni, Pathya Punarnavadi Kashay, Chandra Prabhavati, Karutha Gulika for Lepam, and Uttama Rasayan. The clinical response was encouraging. Over approximately 3 months, the patient's visual acuity returned to 6 by 6, while the ocular deviation and proptosis completely resolved, with objective follow-up showing resolution of the lesion in this individual case. I present this simply as a clinical experience, not as a generalized claim regarding the treatment of orbital schwannoma. For me, the important message from today's discussion is that Ayurveda offers us multiple therapeutic possibilities, including classical herbal approaches as well as carefully selected metallic and mineral formulations. The real need today is to understand these approaches scientifically, identify the appropriate clinical indications, document outcomes systematically, and generate evidences through well-designed research. And this is precisely why I feel Dr. Bindari's presentation is so valuable. Sir has not only presented formulations, he has encouraged us to revisit our classical knowledge with a contemporary clinical perspectives. I sincerely congratulate and thanks Dr. Yogesh Bandare sir for such a scholarly, clinically relevant, and intellectually stimulating presentation. Thank you, everyone. Thank you so much, sir.
Thank you, Dr. Jadhav sir, for your valuable observation and insight as well as your case study. I'm sure that the perspectives of Dr. Golecha ma'am, Dr. Rajesh Pawar sir, Dr. Puranik sir, and shared by both of our moderators will further enrich today's academic discussion and provide us with some important take-home messages. We have some questions, Dr. Bendale sir, from chat box. I will request Dr. Rajendra, please carry on.
Okay. Sir, first question is from my side. What is the role of cell cycle rhythm in oncology?
It's a big role. I mean, see, it's like a railways. So when the body is running, or the each and every cell is running on a railway, the cells follow their standard lifespan and life path, and they die naturally, which is called as apoptosis, as we all know. But there are certain cells, because of some either causative factors or genetic factors or epigenetics, which is all nothing but lifestyle, they derail from these rails, and they keep on moving here and there. When they get favorable condition, that's why the tumor environment, and most important is the environment of the body is favorable. In Ayurveda, we consider it as a sthana samshraya. Is favorable, then these cells starts proliferating. So when the cell starts proliferating at a weaker site, that is where the tumor starts growing. So what we do not have any, any drug as such, at least I don't know, that which is going to kill the tumor. But we have, when we talk about what do we do when we do treatment or chikitsa, so dhatu samyam kriya chokta tantrasya asya prayojanam. So, I mean, to establish the prakriti is the main objective of dealing with the vikruti. There is a basic fundamental difference between addressing vikruti. Addressing vikruti independently is one thing, or establishing prakriti by keeping vikruti at the back of the mind is another approach. That is what the Ayurveda is. So if we keep on establishing prakriti, then vikruti goes off naturally. Jatasya hi dhruva mrityu is the principle comes in mind. And that is how the cell cycle rhythm is a very important phenomena, and especially the Rasayana's action is actually because of that. We did lots of animal trials in collaboration with Tata Memorial, and we found that Ayurvedic Rasayanas are given to the animals when they are given the to induce the tumors for 10 raised to 6 cells were given to give rise to the tumor. But with Rasayana, 66% of the tumor, that is a two-third of the animals, didn't show up tumor at all. And one-third of the animals which showed up the tumor, which is hardly the maximum biggest tumor, was the half of the gram dal, not even a full gram dal, half of the dal, as compared to the test this thing positive control, which is bigger than a lemon on the back of the animals. That is a xenograph study. So that's the importance of cell cycle rhythm and importance of rasayana.
Sir, one question from my side. How do you see the role of early detection and screening in cancer involving head and neck region, particularly from Shalakya perspectives?
It is not at all the Shalak is this thing, madam. Here, every cancer needs to be diagnosed early, and that's why the screening is very important. And in Vagbata Sutrasthan, if I'm not wrong, second this thing, or I think the first chapter, it is mentioned that how one can be cautious, how we have to be cautious on a daily routine. That, and then if we are very cautious and conscious about our standard health parameters, we always focus on the what is wrong with me. But are we focusing on, is there everything right with me? And that is where the importance of Swastha Vrutta comes in. So whether I am hungry every day, whether we are drinking enough only when we are thirsty. So those are the typical parameters we all know from Swastha Vrutta point of view. And if your Dinacharya is explained, Rutucharya is explained, if we follow all those things, then cancer prevention is ideally very easy. And it has been quoted and published by Western scientists also that 90% of the cancers are easily preventable. But unfortunately, nobody talks precisely that what does it mean by easily preventable? What the lifestyle is to be done, and all is now coming towards Ayurveda under the name of functional medicine. So what is functional medicine is all nothing but Ayurveda. So no, none of the symptom needs to be taken lightly, and not everything has a screening tests. And I always think from our country point of view that our country can't afford mass screening for various reasons. So more and more we educate our patients how you should measure your health on a daily basis. Ideally, I think the cancer prevention has to happen.
Very true, sir. Thank you. Thank you very much.
Thank you, sir. Next question from chat box is, what are the reasons for formation of cancer as per various dhatus? That is Hetu, Purarup, Lakshan. Then what is the cause of Vyadhi? That is Spotak Bhav.
Sorry, can I see the question? What are the reasons for formation of cancers, right?
Yes.
Sir.
Yes, sir.
Various dhatus. Yeah. As we were talking in our talk that Rakta and Shukra Vikruti are inevitable for cancer. That is where the Jeevan and Janana Karma are at stake. And that is what it causes cancer. And again, as I just mentioned, that Sthana Samshraya, where the tumor is formed, or Abhivyakti, we consider as a Vyakta, Vyakti, is been seen where we locate these tumors through clinically or maybe through some imaging techniques. So these are, and according to there are family histories, there are, uh, your work-related hazards or lifestyle issues leading to cancer. And nowadays, unfortunately, ahar, what we are eating, is playing very, very vital role. We think that we are buying it from the best of the best place, but it is flooded with chemicals, and we don't know that which people are, susceptible to convert these chemicals into a carcinogens, though they are known to be carcinogens. But these things are becoming very, very risky nowadays. And so the only thing is that we have to try to prevent as much as we can and follow Ayurvedic principles as we can. Though I know that being Ayurvedic, being doctors, uh, our own lifestyle is already went for toss, but at least we can tell this to patients. And so these are the reasons. I mean, we consider all these reasons while formulating these rasayanas. And as I said that the main rasayana which we give in the morning as a Vyadhi Pratyanik rasayan, which works on the cell level. The second is the post-meal powders which we are giving for symptomatic management and overall body management. We can call it as a whole system approach. And at night, we give couple of rasayanas depending on the various targets. If you want to target on liver, if you want to target on bones or lungs or any other organ, those rasayanas are given, and which are improving either tumor environment or making the rest of the other vital organs so strong that even if the malignant cell reaches over there, for example, liver, it is not able to proliferate and it should die naturally. That is, undergoes apoptosis. So these are the principles of making, or the reasons of making these rasayanas. And obviously, as per the dhatus and organs and systems, that is all mentioned. In one of my talks, I always give this, there are 20 principles of making these rasayanas. So like 20 gunas we have. So that's not today's pocket topic, but I have delivered couple of lectures on what is the principle, what are the principles behind making these rasayanas, and those are 20 principles. So we can share that at later part, or one-to-one. I can give those things to anyone who is interested. And unfortunately, we don't get into Purvarup or these kind of things, because when there is Purvarup established, then the Samprapti is already over. And when we are in clinical practice, either patient comes after chemotherapy or at least after biopsy when the disease is already established. So we have to, we are more on a firefighting then getting into the understanding of hetus and my hetu parimarjan, as I already mentioned, that plays a reasonably limited role in cancer management. Thank you.
Sir, another question from chat box. What is the approach to benign eyelid, scleral, and limbal masses, particularly for preventing recurrence after excision?
Yeah, that's the interesting thing. I never come across this kind of thing. So my answer is absolutely based on logic and theory. So we give couple of because we come across other kind of recurrent masses which are benign. So generally we provide LEPA and a rasayan like Dasma rasayan, which helps in either delaying the recurrence or preventing the recurrence. But Dasma is the rasayan which contains Hiraka and Tamra, which is Lekana, Tamra, which is Lekan in action. So that is what we give.
Okay, sir. Another question from chat box is, can Ayurveda reduce the chemotherapy-related side effects?
Can Ayurveda reduces the chemotherapy related side effects? Okay, this is a good question. There are various side effects of chemotherapy, especially myelosuppression is the one, and rest of the other for which hampers the quality of life. So, what Ayurvedic medicine does, as I said, is that it gives strength to the good cells of the body. In what our scientists keep telling me, that there are very protective cells of the body. They consider as a T cell lymphocytes or immune cells or NK cells. So we feel that Ayurvedic medicine strengthens these cells to protect our body in a better manner. So what chemotherapy does is that chemotherapy is, in a way, it's a senseless treatment. It can keep on killing any cell which is coming across, which has a potential to grow at a faster rate. And chemotherapy is designed to kill any cell which is dividing at a faster rate. And that's why these bone marrow cells are fast dividing, the GI tract cells are fast, the hair growth is faster. That's why we see the side effects on these levels. But I do not see that with the help of Ayurvedic treatment, the hairs are not fall. But yes, the interesting thing what we have observed is that chemotherapy has to act, but there are long-term side effects of chemotherapy, and which is being seen clinically in a way that after chemotherapy is nothing but like giving a shock to the bone marrow cells. So when what level of shock bone marrow is has received, and what is the rebounds of bone marrow or the recovery from of bone marrow from this shock, this is directly proportional to the long-term survival of these patients. Nowadays, it has been seen also that after chemotherapy and completion of the primary cancer, patients are suffering from second cancer. It is not the secondary, the second cancer. And second cancer is happened largely due to the chemotherapy. So this is also the area of interest for Ayurveda, is that if Ayurveda treatment is given along with the chemotherapy, maybe we can reduce the recurrence, maybe we can reduce the prevalence of second cancer in addition to the other added benefits of Ayurvedic treatment along with chemotherapy. Resistance is again the another thing which is reduced while giving chemotherapy and rasayan therapy together, because that's a bigger challenge for chemotherapy. So in a way, it's a complementary, and it's a compatibility is also there.
Sir, Dr. Madhusmita says, thank you, sir, for your valuable suggestion. Her question is, can rasayan therapy can be given during radiotherapy? What are the pathya apathya to be followed? Rasayan therapy can be continued till what period in SCC?
Yeah, so we are generally advised to give rasayan therapy along with radiotherapy. There is a reason, because these rasayanas contains metals, And it is seen that these metals act fantastically when patients is undergoing radiation therapy also. So it can be given. Generally, it is given obviously along with the radiotherapy, that is 30 cycles on an average, generally given, except in rare cases, only 5 or 10 cycles, but generally 30 cycles are given. And it is to be continued along with the radiation and post radiation also. That is what our different protocols are. And I mean, after 6 months, we try to find out that what is the response to radiotherapy and rasayan therapy together. Now the question remains about the patya patya. Honestly, I am not a guy. I'm not a person who studied well about diet, and I personally have a person. This is completely personal opinion. This is not considered to be a medical opinion as such. Most of the cancer patients reaching us at the end of life or advanced stage of cancer, and I don't believe them to put on large restrictions of food, because we know that they are going to survive for 3 or 6 months. Let them enjoy whatever they want, give them, make them happy. Because what is ultimate aim of a doctor? To see cheerful faces, happy faces. That is ultimately our goal. If we restrict people with multiple things, I even tell them, if you want idli sambar, go for it. If you want my misal, go for it. I am sure if you restrict them, then they ask for it more, and they become more distressed because they have been advised not to have it. But if you tell them, I'm sure they are not going to have it, because they can't digest, they can't have the full idli sambar or something. But they feel better that I'm not at least restricted, and it doesn't make big difference in the treatment outcome, honestly, with a very limited span. So our approach is, to spread happiness. So our tagline is like this: live long happily. So nobody knows anybody's lifespan, but happiness is in our hand, and we are there to spread happiness. So that's my take on patya patya.
Okay, sir. Sir, next question from Dr. Nand Kumar Patil, sir. Sir asked, treatment for singer's nodule, treatment for benign growth over vocal cord.
Yes, doctor. The gargles or gandush works phenomenally excellent in this, and you can simply try Trifla with Daru Haridra, with Haridra, with Musta, and every day, twice a day. It works really wonderfully well. And simply Sukshma Trifala or even other drugs, whatever you think appropriate, really works wonderfully well. The another very interesting, simple, almost freely available thing is that black raisins with seeds, काळ्या मनुका, बियांसकट असलेल्या, बियांशिवाय नाहीत. Ask these people to keep on chewing. Don't eat them. Keep chewing and eat with the seeds at the end. And whole day, the dose is 50 grams per day. And see, it works wonderfully well.
Sir, Dr. Pranav Gupta says, can you please explain the concept of Vyadhi Pratyanik Rasayan?
One is the dosha pratyanik, as we know, and other is the Vyadhi pratyanik. So what is Vyadhi, as we all know? That dosha dushya sammurchana is nothing but samprapti. And when we look at the Western science, why Western science has dominated? Because they work on very specific target of breaking the samprapti. So if there is a microbe, they understand, they give that particular antibiotic. Nowadays, everybody gives these broad spectrum antibiotics. The moment you control the colony of a bacteria or microbes, rest of the things starts falling in place. So Ayurveda has a very different, unique understanding about samprapti. So Hetu plays a part, doshas plays a part, dushas plays a vital part, even malas plays a vital part in this samprapti, and the disease happens. The moment, if we give, for example, I'll give you this example, ENT example. For example, the This happens with my own daughter. I'm sharing the story of Ishani when she was very young, hardly, I think, 2 years. And she was suffering from extreme ear pain in the middle of night. And at that time, we gave something just to let her sleep, and we also. And in the morning, we have taken her to the pediatrician. Then that time, if I'm not wrong, the Cipodum was the antibiotic, maybe recently introduced. The pediatrician provided given this Cipodum. Then we thought that we don't know what has happened. So if we want to give Cipodum, then we go to the ENT doctor and try to find what is there, because her ear ache was persistent and it was quite severe. Then we went to Dr. Dapke. Dapke was our teacher also, and we took her to his private clinic on Curve Road. Dapke sir has seen her and asked us to do two tests. One is audiometry and second was the impedance in bilateral ear. Then we performed these tests from some, I think if I'm not wrong, this is maybe 25, 27 years to old story or something. Some Dr. Nikam was there in front of a SP college. So we did these tests and showed to Dr. Dapke sir. And Dr. Dapke informed us that, look, there is accumulation of fluid in bilateral ear. And we have to go for a grommet. And I thought she's a girl and I don't want to get into the surgical thing at this age, etc. So I was curious to ask him that, sir, can I handle? But I don't have the clinical understanding in ENT. And she being my daughter, we couldn't take any risk that something goes wrong with her listening abilities. So those sort of things I honestly asked sir that can I try Ayurvedic medicines? So sir said you can try, but not more than 2 weeks. So we started. So what was the symptoms? There was a lot of pain in the ear, continuously nagging, and a headache on that side. So if we wanted to treat the symptom, then we would have thought about what is the treatment for headache, what is the treatment for ear pain or something like that. But with the help of impedance, thanks to the technology and Dr. Dapke sir, he is a gem of the person, as we all know. He explained me that, look, this is not going to work, Yogesh, because this is how it happens. He took the pain and explained me that, look, this is the tympanum, this is the middle ear, and this is where the accumulation of fluid is there. The tympanum is intake, where the fluid is going. So I don't think it is going to work. I said, anyway, chalo, dekhte. So we started, and I gave her a drug, which is, then I understood what is the samprapti has happened, and gave the drug which helps the absorption of fluid, which is, we believe, the samprapti bhanga, which is a vyadhi pratyanika chikitsa. The dosha pratyanik chikitsa, lakshanik chikitsa was basically focusing on the pain management, or maybe at times the infection management. But we don't prefer to use those drugs. We prefer to use the drug which can absorb the fluid, and dasma was the rasayan was given at that time, single capsule, and then couple of other herbal mix was given. After 2 weeks, we went to Dr. Nikam, did the audiometry and impedance. I was not able to understand what does it mean, honestly. And then took to the Dapke sir and asked him to explain. Dapke sir, this is very interesting and this is very good. Now you have 1 month to keep continuing your medicines. We don't want to get to the grommet as of now. We continued the treatments for 1 month. Again went to the Dr. Niman, did the impedance audiometry and submitted. I swear God, Dhanvantari, Dapke sir was overjoyed, took both the things, and he kept both the things in his drawer, said that, Yogesh, this is a case to be presented in the international conference, because there is a complete drying up of the fluid with the help of Ayurvedic medicines. And where this fluid is gone. So I said, sir, we don't understand the nitty-gritties of ENT. I thought I was telling only based on the logic. I don't know where the fluid will go, but I can think that the fluid can go from the same route from where it has come. So that was a very logic-based answer. But Dasama, till then, from that time, we are still using Dasma to take care of pleural effusion, even ascites, knee effusion, any effusion of the body. Drug choice is Dasma Rasayan. That is the difference between Vyadhi Pratyanic and Dosha Pratyanic or Hetu Pratyanic Chikitsa.
Yes, sir.
Great.
There is a last question from chat boxes, sir. What is the Ayurvedic treatment for breast fibroadenoma?
It's a complex treatment. It's not a simple one, but one has to go to the history of menstruation history. Then fibroadenomas has to be kept under observation all the time, because there are incidences to mislead fibroadenoma from that. So we have to look at the BIRAT score and other symptoms of a lady, any other past history of taken any hormones or the lifestyle which needs to be corrected, etc., and correcting the normal health of breast and the menses together generally prevent these fibroadenomas converting into cancer, or they can be reduced to complete normal also.
So interesting. Yogesh, there are so many participants. It's a 10:37. But see how much interest is there in oncology of Shalakya Tantra. And I'm very proud of you as a friend. But I want to say thank you also from Tas family that you are contributing in every Shalakya conferences to the trade exhibition by the stall from Ayurved Rasayani, and you are coming to Thrissur also. Pawar sir, Puranik sir, he already booked.
Yes.
Yes, yes.
Yes, I understand. Thank you very much, doctor.
Yes, sir.
There is a very good collaboration with Dr. Bendale and Shalakya Tas family.
Yes.
Can I conclude, ma'am?
Yes.
Ma'am,
Yes.
we can,
Okay.
ma'am, I want to add something
Yes,
in your
yes.
discussion, further to your discussion. We can think of development of a subspecialty in our Shalakya Tantra as an integrative oncology. Maybe it can be an ocular oncology, it can be an ENT oncology. So we can think regarding the collaboration with Dr. Bendale sir in future through TAS, and we can develop our subspecialty, and we can start multicentric trials as well in this field, so that it will be very helpful to generate evidences.
Very nice suggestion. Puranik sir and Pawar sir will throw light on this.
I think yes,
Yes,
sir,
please go.
please. No, you please
No, you
go,
please
sir.
go on.
पहले
no,
आप
no.
पहले आप वही बोलो.
Yogesh sir is already into this research funda. I remember the research for diabetic retinopathy. It
Yes.
was multicentric study. It was double blind, and the moment we realized that there are fantastic results for all diabetic macular edema cases, and my hospital was one of the center for these studies. Another was Kerala, that is Belgaum, KLE University, and the third one was Hassan, SMBT. Uh, Almost, I think, 250 cases were studied, and those were reviewed by a third party sitting there in the US. And after the results, those were published, those were fantastic results. Definitely, on the same ground, we can go ahead for this suggestion, as Dr. Praveen Bhatt has now mentioned. And multicentric study is the answer for all, I think, research. That is the basis. And in India, we do have a number of cases. So, being for multicenter, definitely will get the huge data. Thank you very much.
Without saying thank you to Thimirex R, Dr. Bendale's presentation will not over.
Yes.
Yes, yes, sir.
Puranik sir.
No, it's actually what Bhatt has suggested is very important and can be kept for consideration in some meeting, and after proper discussion, we can definitely go for it, what he has suggested.
Yes, yes.
Yes, sir, we will definitely think of it. Praveen, very good idea, but you have to take initiation for that, huh?
I'm All India
Yes.
Institute of Ayurveda already collaborated with Dr. Bendale sir through a tripartite MOU. We have tripartite MOU with Government of Goa, Tata Memorial Center, and Bendale sir is also one of the member in this tripartite MOU. So we have initiated, but anyways, it's lacking regarding the Shalakya Tantra specialty like head neck cancer or ocular oncology. Many patients coming like breast cancer or intestinal CA or anal CAs and all these things. But we need to generate the evidences in our field. That's why I have emphasized regarding the development of this subspecialty.
In general body meeting at Thrissur, Kerala, we will definitely think of it and we'll do something positively.
Yes, ma'am. Thank you very much.
Thank you, sir. Thank you, Yogesh. And thank you, everybody. Good night.
Good night.
Thank you, everyone. Good night. Bye-bye.
Thank you, Sunil and Entered family also. Okay.